We've had this conversation before, but it's interesting in light of these new numbers. I think it bears diving into this issue again. Lauren was mentioning strep A. That's common infection, isn't it? Just help us understand basically what we're dealing with.
Yeah, it's an unusual type of bacteria in that it can do a lot of different things. So a lot of people are familiar with strep throat. Okay, so it's a bacterial infection of the throat, causes what we call pharyngitis, or that throat pain, that throat inflammation. Sometimes that can spread to the tonsils, cause a tonsillitis. If it's very aggressive, it can even spread, cause an ear infection, cause an abscess, but typically it's just a throat infection. Sometimes that's associated with a rash, these sort of fine red bumps called a sandpaper rash. In that case, we call it scarlet fever.
Right.
But it can trigger the immune system in unusual ways. So this bacterial infection can cause an immune reaction which causes antibodies which can actually attack normal parts of the body, like the heart valves. That's called rheumatic fever. It can attack the kidneys. That's called glomerulonephritis. So strep has some unusual manifestations.
So in this particular case, then, what causes it to become, or how does it become aggressive and then invasive?
Right, so
and get into the body.
And it's a different animal. And as you say, if it's invasive group A strep, or what's called IGAS, it's usually different subtypes of the strep. And that's when it gets into parts of the body where it shouldn't be, like the lungs and cause pneumonia, like the bloodstream where it can cause shock and organ failure, or the skin and muscles, deep muscle tissues, where it can cause this necrotizing fasciitis, or what people call flesh-eating disease. And so it's for reasons that are unclear, and it doesn't happen in everybody, but certain subtypes of strep can be very aggressive and cause these types of infection. So it has this whole spectrum of the types of diseases it causes.
So not exactly clear how it even does this, but is there any obvious explanation for why the numbers are so concerningly on the rise?
Yeah, it's a great question, because it was happening before the pandemic. You know, for over a decade, we've seen an increase in these invasive types of strep infections. Unclear why that is. We know that they're more common in very young children under 1, or people over 50, and people with underlying chronic diseases. So there are more and more people surviving longer with chronic diseases, often diseases that weaken their immune system. That may be part of it. We also know that strep is opportunistic. It tends to cause infection when the tissues and the body is already weakened. And so it often will follow a viral infection. And so we certainly saw a lot of viral infections during the pandemic.
And now, I mean, we're talking about the triple-demic of RSV and flu and COVID. So it follows those primary infections and can take advantage. So if those numbers are going up, perhaps there's some connection to the increase in this invasive form of strep A. What was interesting in Lauren's piece, and interesting and devastating to hear, is the mothers saying just how quickly this took effect. And for parents, there might be some confusion because the symptoms sort of overlap with more common things. What do parents need to watch out for first?
Yeah, you know, the invasive forms are rare, but as you heard, devastating in that it causes this immune response. You know, the bacteria, in this case, it must have been a toxic shock syndrome, as we call it, where the bacteria gets into the bloodstream, it releases toxins, the immune system responds to those toxins, and that causes kind of a storm where the blood pressure drops and the organs start to fail, and that can progress very quickly. And similarly, if it gets into the muscles, that can progress very quickly. And you've heard that, you know, despite antibiotics, it often the only way to treat it is to actually amputate, is to remove the tissue, which sounds very barbaric. So it depends where it is. If it's in the lungs, you're going to have more of those pneumonia-type symptoms. If it's in the muscle and deep tissues, it's going to be pain, redness, inflammation in that area. If it's a toxic shock syndrome, it's high fevers and symptoms of low blood pressure, so confusion, lightheadedness. And then, of course, if it's in the throat, it's basically a strep throat. It's that throat pain with swallowing, that tonsil pain. Sometimes if you look at the tonsils, you can actually see a little bit of pus on the tonsils. That's a clue, along with the fever, and plus or minus that scarlet rash, which is quite telltale for this.
So I guess, I mean, initially with a strep throat infection, you might, as a parent, deal with it yourself, or just, you know, how you would normally treat that. But what would trigger something that you would, you know, really spring into action quickly, go to get medical attention? Yeah,
so I think a couple of things. One is, even for the strep throat, you want to see a doctor, get a strep test. We have rapid strep tests, and get antibiotics for that. And so the first thing is, how do you distinguish, because it's so common right now, especially for people to just have a viral infection, a viral throat infection. And so one of the things about viruses is they tend to cause more diffuse symptoms. So eyes, nose, throat, you're hoarse, you're coughing. Whereas bacteria tend to be more focused, and so it's going to be more focused on the throat. So if you have, those more local symptoms of just the throat along with the fever, that's more likely strep throat. The warning signs are when you're getting into severe pain, high fevers, persistent fevers, and particularly that lightheadedness or confusion. That's when you really need to seek attention.
And then don't hesitate. Get right in there. Okay, Dr. Gupta, thanks very much. Yes.